My name is Heather Jacobs, and I'm a medical student at the University of New England. And today I will be discussing changes to physician practices that are non-essential. As with the stay-at-home order, changes in physician practices are aimed at slowing the spread of COVID-19 and providing the healthcare system with the time and resources to respond to the pandemic. The general recommendations from the American Medical Association and Centers for Disease Control and Prevention have been to stop or decrease non-essential care by making alterations to essential care to better address the challenges posed by COVID-19. By limiting non-essential care, the goal is to decrease person-to-person contact and free up the healthcare workforce to better address COVID-19 related illness and other urgent medical needs.
So what exactly qualifies as non-essential care? The American Medical Association defines non-essential practices as elective ambulatory provider visits. This is care given to patients who are not required to stay in the hospital. Additionally, elective and non-urgent admissions are considered non-essential. For example, a general wellness visit. It is suggested that we delay inpatient and outpatient elective surgical and procedural cases. We see the term elective here again, which essentially means non-urgent. Elective care is health care that is scheduled ahead of time and is not considered an emergency. Additionally, it is encouraged that patients postpone routine dental and eye care visits. Again, while important, these types of visits are not urgent. Now let me give you an example of these terms elective, non-urgent, and non-essential.
For example, if I hurt my knee before COVID-19 began and I had surgery scheduled to repair it, that surgery is considered elective and will be rescheduled due to COVID-19. If I had hurt my knee during COVID-19 and after doing a telemedicine call with the doctor, there was a concern for a ligamentous injury that might need repair, I would not be scheduled to get my knee checked out in person at this time, but instead this appointment would be delayed until after COVID-19 changes, since this injury is not an immediate threat to my health.
There are certain types of outpatient visits, such as dialysis, which must occur regularly and can be necessary multiple times per week. These types of visits are considered essential, and for these circumstances, patients and staff must wear a face mask and abide by the CDC guidelines for COVID-19 protection. There are many forms of care that, while not requiring urgent attention, are still very important, such as prescription refills or support with a chronic illness. The AMA and CDC have urged practices to provide telemedicine in such instances. Additionally, regulations on telehealth have been modified, such as by eliminating federal government penalties on clinicians who are initiating telehealth efforts. This is so that physicians may implement this type of remote care quickly and effectively. Telemedicine is usually tightly regulated to ensure that telemedicine care is deemed equal to the care that patients would have received in person. While COVID-19 has caused there to be some leniency in order to allow for more telemedicine to occur, physicians are still required to uphold professional, ethical, and legal requirements to ensure appropriate care is given to their patients remotely. Many video meeting platforms have been designated HIPAA compliant, meaning that they have entered into the HIPAA Business Associate Agreement and are suited to keep personal health information safe and protected while in a virtual format. For more information and to learn more, go to publichealthcoalition.org.